Hello. Thank you, Dr. Gonzalez. That was beautiful. So great and honored to be amongst you all today. My name is Michelle Kanjan. So I'm a member of the Navajo Nation. I am of the Big Water clan. Father's clan is the Folded Arms People clan, and both grandfathers are of the Honeycombed Rock People clan. So I come to you today with different, I guess, an integrated perspective comprised of my nursing background. I'm a nurse, and I've practiced as a psychiatric mental health nurse practitioner for many years in the Indian Health Services, with the Indian Health Services in my home community of Fort Defiance, Arizona. Also in Sitka, Alaska, with Alaska Native villages there in the southeast region of Alaska. And then I had a really traditional upbringing. I was immersed in a lot of the Diné culture, Diné ceremony. My mom was a traditional practitioner. And so I've had, I had no choice but to integrate a lot of this traditional knowledge and these practices with my clinical knowledge. And so that brings me here today. I'm currently at the Johns Hopkins School of Nursing, working with Teresa Brockie as a research associate. And so I'm glad to be here. The first thing, we can go to the next slide. Actually, we're going to go to the next slide beyond this one. Then I'm going to ask you to come back to this one. So the first thing I want to share with you all today is this Hojan resilience model. And this really, there's a lot of connection and similarity to what Dr. Gonzalez has just shared with us all. And this work started with my dissertation work. And I really wanted to focus on something positive, something hopeful. You know, with my years of clinical practice in psych mental health on the Navajo Nation, I was daily faced with trauma, crisis, suicide, substances, you know, with the patients and trying to help them navigate their ways to a place of health and healing. And so when I got to this level of study, I thought I need to focus on something positive, something hopeful. And so Hojan is a term in Navajo that really refers to health and happiness and well-being and positivity and peace and everything that is beautiful. And similarly to Dr. Gonzalez's message, it's about a path. It's about walking this walk of beauty through life. And there are so many teachings, and reducing it to a model is almost very disrespectful in many ways. But it's also necessary for our youth and our younger generations that need to conceptualize these really rich, dynamic teachings in something that's tangible, something that they can read about, something that they can conceptualize. And so there's a translation that had to occur, an integration of some of this really rich, deep cultural knowledge and try to frame it. And that was the work that I did here. And so basically the message I want you to get from this model is it's intended to be a protection shield. So there's an image of a shield here. In life, as we move through life, there are many challenges that we go through. And a lot of the Hojan teachings, the teachings about walking in health and in beauty and in happiness and in peace, really refer to ways that you really discipline your mind, your thoughts, your actions and behaviors, and your practices in every day and every moment to honor these three dimensions. So I use the symbolism of arrowheads here as, again, a protective symbol, a shield that's intended to protect us as we go through life. And the three domains are really a domain of relationships, which is the very top domain. Down to the lower left is a domain of respect of self, others, the environment. And then this last domain on the lower right-hand side is this domain of spiritual practices and spirituality, which I refer to as sacred loyalties. And so when you think of these, the arrows represent the interrelatedness and the overlap. As I mentioned, it was really hard to categorize and break up these things because they're all so connected. And when I speak about respect falls into the other two domains as well. So I want you to just envision this three-pronged or this three-domain shield of Hojan and these practices as we move forward. There's so much history that goes to the model, but I just wanted to stress that we are emphasizing that American Indian culture, indigenous culture can be protective. Spirituality can be protective. Language preservation, speaking the language, as Dr. Gonzalez mentioned, practicing the practices, learning about the wisdom and the teachings and the stories, all of those things. And then healthy relationships and respect of self, respect of others, respect of the environment. Those are the key tenets of this model. So I'm going to take you back to the previous slide. And there's so much more I could say about Hojna, but today I wanted to share with you, just introduce that model to you as a model that I've been studying over the years. Some of the significance that we found in the model is that really these attributes, if you can practice these ways of being in the world, tapping into those 3 domains, that you can really have and start to move towards psychological health. You can also start to move towards collective health and individual health, family health. And so it's there's a lot of discipline and mindfulness embedded into the model. When I think and reflect back on how I was introduced to some of these teachings, the first 2 things that pop into my mind are my grandmas, my grandma Alta, my grandma Darlene. They were very quiet Navajo women. They never really lectured me, but they did scold me. Like, they were kind of disciplined about the things that I was saying, the things that I was doing, the things that I was thinking, and they would correct me. So there was a behavioral, I guess, molding that was happening. And they were also role modeling for me some of these attributes of living this life of Hojna. So they were really careful about teaching me about keeping thoughts positive and being future oriented and being strength based and being positivity focused, just focusing on things that are positive and beautiful and harmonious. And so there's a lot of mindfulness, a lot of internal work that an individual has to do to really carry these attributes from moment to moment, from day to day. And I think it's reflective of what a lot of our relatives are maybe working hard to try to develop. This might be a gap in the way that they're trying to learn about themselves and care for themselves. A lot of times we don't have the role models, or we don't have the teachings, so we don't have enough of a toolbox to really help us to be healthy and to walk this path of beauty. And so I'm going to move into this second bullet on this really busy slide, and this is intended just for me to kind of guide my story here. But in my work as a psych mental health nurse practitioner, I love the practice. I love being a clinician, and most of my work is about psychiatric assessment, psychiatric medication management, prescribing and treating depression, anxiety, psychosis, crisis management when people are contemplating suicide or really just in severe depressive states. But I also recognize some of the limitations in that Western model of healthcare delivery. And so we have gaps. First of all, we don't have enough mental health providers, especially in Indian country. And then culturally aligned models are very lacking. We've mentioned that in this morning session, and now in our sessions, we're really emphasizing the need to bring forth culturally informed models of care that are tailored to each individual Indigenous community, because we're so diverse in our beliefs and our practices and our stories and our healing interventions. So bringing cultural alignment to these settings is going to be really important, and utilizing some of the resources that are available. So a recovery model really focuses on utilizing even lay community members, traditional practitioners, people that are available in the community that are invested in the healing and the well-being of their community. Those are key people that can really help move the health of a community forward. And so I wanted to briefly talk about integrative models of treatment, though I really have a lot of pride in the model that was developed at Fort Defiance Hospital years ago, which still is there today. Many organizations have brought together Western medicine right alongside traditional medicine, and it can be very beautiful. However, it can also be we must proceed with caution when we think about integrating models, because sometimes there are things that can be very disrespectful to the traditional ways of doing things. So I just want to kind of put that message there. Like, as we think about integration, be very mindful and use your elders to think about ways to do it in a really respectful, meaningful way. Creating the spaces to house some of these traditional interventions is really important. I've learned that bringing some of these practices to a hospital setting sometimes is not the best practice. So creating additional spaces where these things can happen in a respectful manner is important. And I noticed that I have a few minutes left, but I'm going to talk briefly about a study that but first, I'll just mention there's tension that exists about studying outcomes of ceremony. My work, I'm really focused on studying the outcomes of ceremony, not the processes or not revealing some of the secrets of the sacred protected practices, but really just looking at what are the benefits of these ceremonies. And so we did offer one intervention to 24 individuals on Navajo, ranging between the ages of 18 and 80, I believe, roughly. And they all each had a clinical diagnosis of depression or emotional distress. And we offered a ceremonial intervention to all of them. And some of the insights that we have learned from that healing intervention, I don't even want to call it a study. And this isn't published yet because I'm being really mindful of the respect of this process and really mindful of just how sacred this work has been. But there are many things that we've learned from this project and this intervention and this ceremony that was offered. One is there definitely was improvement in the psychological distress. It was a single group design. There was a pre-assessment and a post-assessment, so a pre and post-study design. And at 30 days post-ceremony, we measured symptoms of emotional distress. And in my work as a clinical psych nurse practitioner, at the 30-day mark of initiating mental health therapy, there's usually very little progress. Usually takes more like 3 to 6 months when you start to see some really big benefits. But with ceremony, at that 30-day mark, we saw really vast improvements in sleep, in appetite, in engagement with family, self-reported, hopefulness was one of the big themes. They seemed more future-oriented, more hopeful. So there was this rapid transformation that occurred over that 30-day period. How and why? I don't know. Maybe the energetic transfers, maybe the family support that comes when ceremony takes place. The person feels centered, the person feels loved, the person feels supported. And then just the energetic processes that are very spiritual, and it's really hard to translate what is happening at that spiritual level. But the overall message of this work is that the ceremony was transformational, and we did have some quantitative measures and some qualitative measures, and we measured salivary CRP levels. We had a downward trajectory at that 30-day mark of inflammation in the body. So these things are emerging, but I just caution and I stress the importance of really respectful practices as we move forward. And I know Dr. Warren mentioned this morning that sometimes it's really, really hard, and how are we going to measure spirituality? How are we going to measure faith? How are we going to measure outcomes of ceremony? So it requires a lot of thinking. It requires a lot of collaboration and a lot of integration of the wisdom of our elders and our traditional practitioners. And so I want to leave you with that message, and I want to just think about the ways as we move forward to create spaces and to transform the research process. Decolonizing is something that we speak about often. And I don't know if that's the correct term, but we really need to change the ways in which these structures that we practice healthcare in must change to accommodate our individual indigenous ways of health and healing. Even the ways that we define health and healing are very different from the Western world views. So I will leave you with that, and I will leave you with the messages of Hojon, and I wish you all much Hojon in your lives and in your families and the work that you all do, the important work that you all do. Yeah.